Okay, chapter 10, the cardiovascular system. You can see chapter 10. Okay. So the cardiovascular system, cardio means heart, vascular is the blood, all the bloodstream, but includes the heart and lungs because blood works very closely with the lungs, and we'll learn more about that. If we look at this picture here, we talked about the mediastinum. The mediastinum is here in the center. The heart, the trachea, this space in between the two lungs, lung lobes, pulmonary lobes, that is the mediastinum. The apex of the heart, this corner down at the bottom is the apex. Left lung, right lung. Left lung has one lobe. The right lung has two lobes. And then the diaphragm, we've been talking about the diaphragm and how it works. We'll talk more about that. So the cardiovascular system pumps blood to the tissues and cells throughout the body, supplies oxygen and nutrients to the tissues and cells, and then it removes carbon dioxide and other waste products of metabolism from tissues and cells. So when we breathe in oxygen, it goes through our body, it nourishes our body, allows us to live. But then the waste product is carbon dioxide. We have to remove that because we can die from carbon dioxide, and the blood will now take it out and we'll breathe it out into the environment and then breathe back in more oxygen. So it's an exchange of both. So the heart lies within the mediastinum. We just looked at that. It's the center of the circulatory system, the most important part. So it's enclosed by the pericardium. Pericardium is a sac that protects the heart. The parietal pericardium is the outer layer. The visceral pericardium is called the epicardium. And then the pericardial cavity is in between the parietal pericardium and the visceral pericardium. It's a space between the two layers. It's got lubrication so that as those two layers rub against each other, it will go smoothly because the heart is pumping back and forth. So those two membranes are sliding against each other, many times an hour. So the pericardial cavity is the space between these two layers that surround the heart, the parietal pericardium and the visceral pericardium or epicardium. Remember, be sure to remember that the visceral pericardium is the same as the epicardium. Visceral means it's up against an organ. Visceral organs are the inside organs of our body. The heart itself, now we know that the heart is a cardiac muscle. We know that, we've discussed that. Has three layers. The epicardium, which is the outer layer. Okay, we just talked about the epicardium. The visceral pericardium, which is closest to the heart, is the epicardium. Well, it's actually the outer layer of the heart. So it's both. It's protective layer, but it's also the outer layer of the heart. The myocardium is the middle muscular layer. So the main muscle of the heart, the cardiac muscle, is the myocardium. And then the endocardium is the inner layer, the inside of the heart, the inner lining of the heart. Okay, the chambers. There's the right atrium and the left atrium. They're the upper chambers, right and left, and there are the receiving chambers. So they receive blood from our body. The right ventricle and the left ventricle are the larger chambers. They're the main pumping chambers. The atrium, left and right, receive blood, but the ventricle chambers, right and left, pump the blood out through the body. The partitions, so the heart is 4 different areas. There are 2 partitions. The partition that separates the left and the right atrias at the top is the interarterial septum. Septum is it's a tissue partition. That's a septum. The interventricular septum separates the left and right ventricles, excuse me. So intra-arterial is on top between the left and the right atria, and then the interventricular septum separates the right and the left. Which layer of the heart is required for muscle contraction? Epicardium, endocardium, myocardium, pericardium. Myo means muscle. We need the muscle to contract because the heart is a muscle. So the answer is myocardium. Myo means muscle. All the others are layers around the heart, around the muscle. So circulation through the heart. Deoxygenated blood, blood that contains carbon dioxide that's been through the body and has other waste products in it, enters the right atrium from the superior vena cava. So it's a large vein. Brings blood from the head, thorax, upper limbs, and the abdominal viscera. So the abdominal viscera means organs. So that's for the right atrium, coming from the superior vena cava. So superior vena cava into the right atrium, blood from the head, thorax, upper limbs, and the abdominal viscera. It also enters the right atrium from the inferior vena cava, and it brings it from the lower part of the body, blood from the trunk, lower limbs, and the abdominal viscera, the lower. Actually, both do the abdominal viscera. So the deoxygenated blood that no longer has oxygen because it's been given throughout the rest of the body, it has carbon dioxide now, from the right atrium and goes through the tricuspid valve into the right ventricle. So it goes from the right atrium down into the right ventricle. We mentioned tricuspid valve. It is a valve that opens and closes. It's got three leaves to it. So it's these three parts that open and close. From the right ventricle, it travels through the pulmonary valve into the right and left pulmonary arteries. So there's a valve called the pulmonary valve in the right ventricle. Then the blood is now pushed. The right ventricle contracts and pushes blood into the lungs. So now all this blood that's deoxygenated goes into the lungs, and from the pulmonary arteries to the lungs. An important point, the pulmonary arteries are the only arteries that carry deoxygenated blood. In general, arteries carry oxygenated blood, veins carry deoxygenated blood. The only time it's different is the pulmonary artery, because that is the artery going from the right ventricle into the lungs so that we can add oxygen through the lungs. So as we're breathing, the air we breathe when we breathe in now goes into the blood that's going through our lungs. So it's an exchange of gases. So as the blood is coursing through our lungs and we're breathing in and out, oxygen is going into that blood and the carbon dioxide is going out through our breath out of our body. We've now oxygenated the blood in our lungs. It now enters through the pulmonary veins, the left atrium of the heart. So here we have pulmonary veins are the only veins in the body that carry oxygenated blood. So again, veins generally in the body contain deoxygenated blood, but because the pulmonary vein is coming straight from the lungs where we just had this exchange of infusion of oxygen, the pulmonary vein is the only vein that contains oxygenated blood. It now goes into the left atrium through the mitral or bicuspid valve into the left ventricle. So bicuspid, this valve has two parts to it that open and close. Mitral, we call it mitral. If you think of a bishop who wears the tall hat and it's got like two lobes to it on top, two. It's because it looks like what we call the mitre cap, but the mitral valve is a bicuspid. It's got two two pieces to the valve that open and close, and goes through that valve into the left ventricle. Then the left ventricle pumps and pushes that oxygenated blood through the aortic valve into the aorta. The aorta is the main valve that now pushes this fresh blood through the rest of the body. From the aorta, it goes to the arteries, to each body part and region. Any questions on that? Okay. Let me just make sure I didn't miss anything. Okay, good. Pulmonary circulation. Circulation of blood from the heart to the lungs for oxygenation and back to the heart. So we just talked about that. It leaves the right ventricle, goes through the lungs, gets oxygenated, and now goes back to the heart, to the left atrium. Systemic circulation, circulation of blood from the heart to all parts of the body. So systemic circulation is blood going all throughout our body. Pulmonary circulation is the blood that goes just in our lungs, through our lungs. Okay, now the coronary arteries. They arise from the aorta near its origin at the left ventricle. So we know the aorta is the largest artery. It's now got this fresh oxygen blood leaving the left ventricle and getting pumped throughout our body now. But part of that blood now goes into the coronary artery. The coronary arteries are arteries that wind around the actual heart muscle. They supply blood to the heart muscle. The heart needs the greatest amount of oxygen and nutrients. It is the one thing keeping us alive. Without our heart, we cannot be alive. So, we can, maybe live for a while without other organs, but without the heart, everything stops. So we need to make sure the heart gets oxygen. The heart uses about 3 times more oxygen than other body organs. So here we see it. We talked about the superior vena cava and the left vena cava coming up from below, going into the right atrium. It goes through the tricuspid valve. It doesn't really show it, but it's got 3 openings. Here you see 2 openings. There's really 3. Pushes it into the right ventricle, which now gives a great big pump and then puts it into the left pulmonary artery, and it goes to the lungs. Then once it's oxygenating the blood, it goes into the pulmonary veins, which go into the left atrium, through the bicuspid valve with two valves to it, or 2 pieces to it, and into the left ventricle. Now that contracts and pushes blood out through the aorta, this great big artery here. Here we see the right atrium, right ventricle, left ventricle. Here is here's the heart muscle, the endocardium, the inner lining, the epicardium, the myocardium is the muscle, the pericardium is this outer protecting cover over the heart, and it's got 2 layers, the parietal pericardium on the outside, and then the epicardium, which is really part of the heart on the inside, and then the pericardial cavity, which is lubricated, so that as it rubs constantly, it doesn't rub, it's lubricated, so it slides easily. Here we see it. Blood comes. The blue means it's deoxygenated. So it comes into the aorta, into the right aorta, left ventricle, pushes out of left ventricle into the pulmonary artery, into the lungs. And as it goes to the lungs, it gets oxygenated back into the left atrium through the bicuspid valve, pumped out, and now pumped out through the main artery, the aorta, and goes through the rest of the body. As it goes through the body, it gets deoxygenated. Now the veins take the deoxygenated blood back up, and it starts all over again. Oops. Okay, we talked about the arteries of the heart, the coronary arteries. So these are arteries that only feed the heart. So when it comes off the aorta, these arteries branch from the aorta and give richly oxygenated blood to the heart and muscle. If there's a blood clot or something that, say, gets stuck on one of these cardiac arteries, coronary artery, that is where you're going to see a blockage. And if it blocks here, this whole vein here is blocked off and oxygen doesn't get to this part of the muscle. This is where we talk about a heart attack. A heart attack is where one of these arteries gets blocked. No oxygen gets to this part of the muscle starts to die. That is a heart attack. And that is where, if they're going to do open heart surgery, they'll go in, they'll remove this dead artery, take a vein from your leg, graft that in, and that will supply oxygen back to the heart. That's what we're seeing there. True or false? Getting oxygenated blood to the lungs is vital to other body systems. False. You need to get deoxygenated blood to the lungs so they become oxygenated. Okay, so how does the heart, let's see. We'll cover this and then we'll take our break. How does the heart pump? What causes the heart to pump? Because it's pumping constantly. It's the conduction system of the heart. So we have the sinoatrial node, the SA node, is a node of nerves that sets the rhythm for the entire heart. It's the pacemaker of the heart. The SA node or sinoatrial node is the pacemaker for the heart. You've heard of artificial pacemakers. Sometimes, especially in older people, the node doesn't work well, so they have to implant a little electronic pacemaker that gives a little electrical pulse every little bit to get the heart pumping, to help it pump. But normally the SA node works on its own, and it causes the atria to contract. This impulse travels from the sinoatrial or SA node to the atrioventricular AV node. The impulse from the AV node travels to the ventricles through the bundle of His. The bundle of His divides into the right and left branch bundles. The bundle branches terminate in the Purkinje fibers. And those fibers fan out throughout the entire ventricle of the heart muscle, so throughout the ventricles. And the Purkinje fibers cause the ventricles to contract. So again, the SA node sets the rhythm. The SA node causes the atria to contract. It also sends an impulse to the AV node, and the AV node now goes through the bundle of His, and then through the Purkinje fibers that go throughout the ventricles, and then cause it to now that will pump the ventricles. So the atria pumps, the ventricles pump. They alternate. So up here in the right atrium, we have the sinoatrial node, and it causes the atrium to contract, but also gives a pulse to the AV node, the atrioventricular node, which is attached to the Purkinje node, it then attaches to the bundle of His. Here's the bundle of His. That then goes to the Purkinje fibers that go throughout the ventricles and causes the entire ventricle to pulse. That's the biggest pump of the heart. Arteries are larger, arterioles are smaller, thinner walls. The arterioles then branch into capillaries, very thin walls, single layer. Capillaries are tiny. They then branch deeper into the body, into the cells, and that's where we have the exchange of materials between the blood and the tissue fluid surrounding the body cells. So in the capillaries is where the carbon dioxide, cell waste goes, and then it's taken through the veins back to the heart. So the capillaries then go to the venules, which are the smallest veins. They take the deoxygenated blood from the cells and transport it back to the heart. So it goes from the capillaries, it goes to the venules, which then goes to the larger veins. There are thinner walls in the arteries, but thicker walls in the capillaries. And then they transport blood from the venules to the heart. So it goes capillaries, venules, veins. The veins actually have little valves that keep, because there's not as much pressure in the venous system as we have in the arterial system. The arteries are very high pressure. The veins are less pressure. So if you were to cut an artery, you're going to get blood pumping out because the heart it's coming straight from the heart. So you've got a strong force of blood. If you cut a vein, it's going to bleed, but it's not pumping out because there's less pressure. But the veins, because there's not as much pressure, they do have valves along the way that keep the blood from going backwards and keep it moving forward. Now, if you look at your leg, and you have your leg hanging down, you can feel veins on the outside, and you can feel little bumps, and those are the valves that keep the blood from going backwards. So looking at the diagram of the heart, what is unique about the pulmonary arteries and the vein? A, nothing else uses pulmonary in the name. B, the arteries carry deoxygenated blood and veins carry oxygenated blood. C, each is connected to the opposite lung. D, there's nothing unique. Well, we already know that here it's backwards for the lungs. The pulmonary arteries carry deoxygenated blood and the veins carry oxygenated blood. It's the only exception in the body. Okay, so let's look at the cardiac cycle. One cardiac cycle is one complete heartbeat. So it's really two separate, kind of a two-part beat. So there's diastole and systole. Diastole is the relaxation phase of a heartbeat. The ventricles relax and fill with blood. Systole is the strong contraction. That's when the ventricles contract and force the blood out. So when we take blood pressure, you'll hear what's systole and what's diastole. What's the systolic blood pressure? What's the diastolic blood pressure? So the diastolic blood pressure is the higher number. That diastolic is the lower number. And if you've ever taken your own blood pressure, you can buy a blood pressure machine very cheaply at any pharmacy or Costco, and you pump up the cuff. You can actually feel the heart. You can feel your arm starting to pump, and you feel the pumping. Then you feel the sound go down, and then you know that it's been measured. So blood pressure is the pressure exerted by blood on the walls of the arteries. Systolic pressure is the maximum pressure reached within the ventricles. Diastolic pressure is the minimum pressure within the ventricles when it's relaxed. The blood pressure cuff and monitor is the sphygmomanometer. It's a long word, but it's sphygmomanometer. And it's used in conjunction with a stethoscope to measure blood pressure. Nowadays, if you're using a stethoscope, it's often already attached to the cuff. And then now we have digital machines that you don't need the stethoscope. It does it all, and it monitors it. It will record the time, date that you took that reading. You can even by Bluetooth send it to someone. So this is blood pressure. So kind of normal, we'll look here at the top, to maintain a healthy lifestyle, the systolic blood pressure should be 120 or less. The diastolic should be below 80. Slightly elevated is systolic 120 to 129 with below 80. And then stage 1 high blood pressure. Here we have the systolic is high at 130 to 139, but also the diastolic is high at 80 to 89. And then stage 2 high blood pressure is 140 or higher for systolic, and then 90 or higher for diastolic. And this is in one of these areas where the doctor would start blood pressure medicine. Symptoms that could indicate cardiovascular problems: anorexia, anxiety, bradycardia. Bradycardia is a slow heartbeat. Brady means low or slow. So whenever you see bradycardia, that's low. Cyanosis means your lips may be blue, which means you're not getting as much oxygen, or your fingertips may be blue. That means you're not getting enough oxygen. Headache. Edema. Edema is most likely going to happen in your ankles, and that's where by gravity you have too much fluid. Your body isn't pumping the fluid through your body as well, so the extra fluid could settle in your ankles, and you get puffy ankles, and that's edema. Dyspnea. Dyspnea is having trouble breathing. Nausea, palpitation, sweating. Tachycardia. Tachy means fast, so tachycardia is a fast heartbeat. So what's the responsibility of the respiratory system? It's respiration, but it's the exchange of gases between the body and air. It through the lungs produces or gets oxygen that takes to the body's cells for energy, and then it removes carbon dioxide from the body's cells. So as the body uses oxygen, it converts it to the waste carbon dioxide, which then needs to be expelled through our breathing. Also, the production of sound. As I'm talking to you now, is because I can breathe that I can talk and make sound. As an example, if you remember, okay, let me just look at the name because I'm blanking. Christopher Reeves. You remember the actor Christopher Reeves? He played Superman. Was in a horse riding accident and hurt his spinal column. He was on a respirator, and whenever he spoke, he still was giving press conferences and doing charity work, but he had to speak when the respirator was pushing breath through his lungs. It's the breath that allows you to speak, that goes through the vocal cords, vibrate, and then allows you to project your voice. It assists in the body's defense against foreign materials. Like when we cough, we're often coughing up something that we breathed in or something that needs to be expelled. External respiration, oxygen is inhaled into the lungs. It passes through the alveoli of the lungs into the pulmonary bloodstream. We'll talk more about the alveoli. Carbon dioxide passes from the blood through the same capillaries into the lungs, and then we exhale it to expel it from the body. Internal respiration. Inhaled oxygen circulates from the pulmonary bloodstream in the lungs back through the heart to the systemic bloodstream to the body's cells. So we deliver oxygen to all the cells in our body. At a cellular level, the oxygen passes through the capillaries. So we said it goes aorta, arteries, arterioles, and then capillaries, which are tiny and go deep into the cells. And that allows the exchange of oxygen. And then carbon dioxide passes from the tissue cells into the capillaries, then travels through the venules, through the veins, into the heart, and then into the lungs to be breathed out. True or false? The purpose of the respiratory system are respiration, producing sound, and defending against foreign bodies. It is true. It's more than just breathing. Another part of breathing is the nose. The external portion is cartilage and bone. That's why you can bend your nose side to side. It's got cartilage, which is softer than bone. The entrance to the nose are the nostrils or the nares. Singular is nares, but nares. Air enters the body through the nose and the mouth. The naval cavity are the chambers inside of our head. There's the left and the right chamber divided by a wall called the septum. So as air enters through the nose, it passes into the nasal cavity. So it goes up into the nasal cavity where the air goes. The paranasal sinuses, they're hollow areas or cavities within the skull that communicate with the nasal cavity. So they're above the nasal cavity and they're open to it. They lighten the skull, so our skull isn't too heavy, and enhance the sound of the voice. So beyond our vocal cords, it kind of reverberates in our skull, which enhances the vibrations of our voice. It's lined with mucous membranes. The mucous membranes help warm and filter the air as it enters into the respiratory system. So if it's cold air, it'll warm it up. Cilia are hair-like projections. So cilia mean little hairs. Hair-like projections on the mucous membranes that sweep dirt and foreign material down the throat for illumination. So you may feel postnasal drip. You'll feel mucus dripping down your throat. And that is the cilia are pushing any dust or dirt that got into your nasal cavities. It will push it through the mucus, and then for you to eliminate it, either by coughing it up or swallowing it. The pharynx is the airway that connects the mouth and the nose to the larynx. The larynx is the voice box where we have the vocal cords. Important thing, many people will still say larynx. I remember the first time I heard it as a kid, I remember thinking, I didn't know it was said that way. It's not larynx, it's larynx. If you look at the spelling, it's YN, so it's larynx, and also pharynx. The pharynx is also known as the throat. So it's a passageway for air and also for food when we eat. The epiglottis covers the opening of the larynx when we swallow. So the epiglottis is a flap that when we swallow, it covers the larynx so that we don't inhale food and get it in our windpipe. But we still do that sometimes. If we're drinking something and we happen to breathe at the same time, we'll start choking. Or if we're eating something or we're talking and then we breathe as we're eating, a piece of something may go into your windpipe, then you start coughing and possibly choking. The pharynx is divided into three sections. The nasopharynx is behind the nose and contains the adenoids. So this would be important to know, of course. There's a lot of important things. We do know this. So the nasopharynx is behind the nose and contains the adenoids. The oropharynx is behind the mouth. Oro is mouth and contains palatine tonsils. And the laryngopharynx is behind the larynx. So the laryngopharynx is behind the larynx. So behind the nose, behind the mouth, behind the larynx. So what is the larynx? We said it's the voice box. It has the vocal cords. It connects the pharynx with the trachea. So it allows us to breathe air in and have it go into our trachea, which can then go into our lungs. Contains the vocal cords, which vibrate as air passes through the space between them, the glottis, producing sound. That's why if you have a cold, your vocal cords may be inflamed, or if you've been at a concert and been yelling, it may be hard for you to speak the next day because your vocal cords are inflamed. They're not vibrating as well as they normally would until they heal. Also known as a voice box. There is cartilage in front of it that protects it, and it's called the thyroid cartilage, and it's the Adam's apple. So you feel your neck, the front, you can feel an Adam's apple. It is much more pronounced in men because normally we have a lower voice. So you're going to see more of it because we have a bigger voice box. The trachea now, so from the pharynx, we go to the trachea. That extends into the chest and serves as the passageway for air to the bronchi. So the trachea splits into the bronchi, which there's two bronchi that go into the left and the right lung. Trachea can also be called the windpipe. It has a C-shaped cartilage, which provides rigidity and patency of the trachea. So rather than letting the trachea kind of slide around, it holds it in place and keep it rigid. The bronchi, the trachea branches into two tubes called the bronchi. Each bronchus, so when we say just one, it's like we say syllabus. More than one syllabus is a syllabi. More than one bronchus, one bronchi is a bronchus. Each leads to a separate lung, either the left or the right lung. Then it divides into progressively smaller tubes called the bronchioles. Whenever we see IOLES, that usually means smaller. So the bronchus or bronchi become the bronchioles, the smaller bronchi. The bronchioles are the smallest branches of the bronchi. Terminal ends are known as the alveoli. The alveoli are air sacs. They have thin walls this is where we get the exchange of gases between the lungs and the blood in the capillaries in the lungs. So it's through the air sacs or alveoli. Alveoli are pulmonary parenchyma. So it's where we get the exchange of oxygen and carbon dioxide. So the lungs are two cone-shaped, spongy organs consisting of the alveoli, blood vessels, elastic tissue, because they do need to expand and contract, and the nerves. This is important. The left lung has 2 lobes. The right lung has 3 lobes. The apex is the uppermost part of the lung. The top of the lung is the apex. The base is the lower part of the lung. The hilum is the portion in the midline region where blood vessels, nerves, and the bronchial tubes enter and exit the lungs. And we'll look at that in the drawing. Okay, so let's go through the drawing. We see the nose, the laryngopharynx behind the mouth. The oropharynx is behind the mouth. Below that is the laryngopharynx. Nasopharynx is higher up. And then the paranasal sinuses are these 2 small sinuses above the nasal cavity. The nasal cavity has different septum little folds that kind of break it into like different little chambers for the air to go through, all covered in mucus. The epiglottis, which is the flap over our between the, that covers the trachea when we swallow. The esophagus, which is we swallow through. So the esophagus is behind the trachea. The trachea then goes into the bronchi. Well, the bronchus. The large tube is the bronchus. No, I'm sorry, I take it back. The trachea then, no, this is the trachea, which then goes into the bronchi, the left and the right bronchi, which then goes into the smaller bronchioles, and then it goes into the alveoli. So you look over here, here's the trachea, the two bronchiole, no, I'm sorry, the two bronchus. The bronchiole are the smaller tubes. And then at the end are these, you'll see the magnification. Those are the alveoli. They're like little puffed up sacs. This is where the exchange of gases between the blood and the lungs occurs in the alveoli. So just as the heart has a protective covering, so do the lungs. So the pleura is a double folded membrane that surrounds the lungs. So there's the parietal pleura, the outer layer of the pleura, which lines the thoracic cavity, and then the visceral pleura, which is the inner layer of the pleura, which covers the lungs. So there's the inner layer that covers the lungs and an outer layer that touches the thoracic cavity. The pleural space is the space between the two membranes, which again does have lubrication, because as we breathe in and out, these two membranes are rubbing against each other, so they do have lubrication, just as
power control is not supporting you.
Just as the lining of the heart does too. A small but very important flap covers the larynx so that food cannot pass into the airway during swallowing. It is called the epiglottis. It means above or on top of the glottis. Epi means above, and glottis. So inhalation equals inspiration. So we said there's a diaphragm. It's a membrane, a strong membrane that divides the thorax from the abdominal cavity. It is stimulated by the phrenic nerve. So the nerve that, without us thinking, allows us to breathe and allows the diaphragm to go up and down is the phrenic nerve. It descends, which means it contracts and flattens. This causes the chest cavity to enlarge, creating a negative pressure within the thorax, and air is drawn into the lungs. I think Tuesday, I kind of said it backwards now that I look at this. So just be aware that when we breathe, when we draw air into the lungs, the diaphragm contracts and flattens or descends, causing negative pressure, allowing air to enter easily. When we exhale, the diaphragm relaxes and rises back into thoracic cavity. So it kind of helps, it kind of like almost like a rubber band, it just lets go and goes back up again. And this pushes air, helps to push the air out of our lungs, increases pressure in the thorax, air is forced out of our lungs. So when we breathe in, the diaphragm pulls down. When we breathe out, it springs back up. During eupnea, exhalation is a passive process due to the elastic recoil of the lungs. So eupnea is where the diaphragm recoils and pushes back up again. Okay, so physical exam techniques that we're aware of what these are. Inspection is visually examining the external surface of the body as well as its movements and posture. So it's a physician will look at, as you're sitting on the table, they'll look at you and, they're talking to you, but they're looking to see, okay, how are you breathing? How does your chest look? How are you moving? Do they see anything that doesn't look right? Are you breathing funny? Palpation is placing the hands or fingers on the external part of the body to detect evidence of disease or abnormalities in the various organs. So it's touching the abdomen, the stomach, feeling for anything that, they may push down a little to feel, can they feel the organs underneath? Do they feel anything funny? Is the liver enlarged? Things like that. That's palpation. So inspection, palpation, know this. Auscultation. Auscultation is when the doctor will usually have you lying on your back on the table, and then we'll put 2 fingers and then tap with the other 2 fingers, and they'll tap, move, tap, move, tap. And they're listening. No, I said this wrong. Okay, no. Auscultation is listening for sounds in the body, the thoracic or abdominal viscera, listening with a stethoscope. That's auscultation. Percussion is where they use the fingertips to tap the body lightly. So they'll put 2 fingers and then kind of tap those fingers and move it around, and they're listening, because if it's a solid organ, they'll hear a dull, flat sound, and an air-filled structure will be clear and hollow. So, healthcare practitioner who does exams like this is trained to listen for the different sounds. True or false? When the doctor listens to our lungs in the office, he is performing percussion. False. That's what I was saying. I got it wrong. It's auscultation is the correct term. I had them mixed up. Apnea. AP means without breathing. So not breathing is apnea. You may have heard of sleep apnea, and you see on TV there are different devices that they sell if you're watching something like Jeopardy or something, and that is where when someone is breathing, they actually stop breathing and then start breathing again. But it's dangerous because they're not getting enough oxygen. They may be sleepy the next day because of it. So that's apnea, where they stop breathing for a period of time. Bradypnea. This one I'd have to look up how to say it. Bradypnea, I think it's bradypnea, is slow breathing. We said Brady means slow, tachy means fast. So this is slow breathing, slower than 12 inspirations per minute. A cough is a forceful and sometimes violent expiratory effort preceded by a preliminary inspiration. So we breathe in and we cough. The glottis is partially closed. Accessory muscles of expiration are brought into action. Air is noisily expelled. So we're trying to expel something. If something's stuck in our throat, if there's phlegm, our body is trying to expel it. So it's always trying to get rid of the things that shouldn't be there. We're trying to get them out. Could be irritation in the airways or an infection, dust, smoke. And then the underlying cause can be determined by the type of cough and the nature, color, and quantity of the sputum. It can be a non-productive or an unproductive cough. There's no expectoration of sputum or mucus. It's what we call a dry cough. A productive cough means you are bringing up sputum or mucus. It's a wet cough. Types of sputum: mucoid, mucopurulent, purulent, serous. Purulent, when you see P-U-R-U, that means pus. So if it's mucus that's kind of a yellow color or green, that's mucopurulent or purulent. Serous is clear. If you're, cough, you blow your nose or cough and it's clear, that's serous fluid. Cyanosis is a slightly, we said earlier on last week that Cyan, CYAN, means blue. So cyanosis means a blue, grayish, slate-like, or dark discoloration of the skin due to the presence of abnormal amounts of reduced hemoglobin in the blood. Well, it means you're not getting enough oxygen. Dysphonia. Phone, if you think of phone, it's sound. Dysphonia, means it's unable to do it. Dysphonia is difficulty in speaking. Hoarseness, maybe due to damaged larynx as a result of infection, overuse, or tumor. Dyspnea, air hunger resulting in labored or difficult breathing, sometimes accompanied by pain. So you're having trouble breathing, you're breathing, pulling breath in, trying to get more air, and they hurt. That's dyspnea. And you're having trouble getting air. Epistasis is a bloody nose or a nosebleed. So know that term. Hemorrhage from the nose, bloody nose is epistasis. The medical term element of breathing is it is pneum. So we know pneumonia. We know it's an infection in the lungs. So lung or air is pneum. And capnia refers to carbon dioxide in the blood. So it would be pneum. Expectoration. To expectorate is to spit up saliva or cough up materials from the air passages leading to the lungs. Hemoptysis. Heme means blood, like we say hemorrhage, or hemoglobin. Hemo means blood. Hemoptysis is coughing up blood. And it could be coming from the lungs, the trachea, the bronchi. Whenever we cough up blood and it's more than just a little bit one time, then we need to find out what's going on. So hemoptysis is coughing up blood. Hypercapnia, increased amount of carbon dioxide in the blood. Hypoxemia, hypo means low, insufficient oxygen, so low oxygen in the blood. Hypoxia, deficiency of oxygen. Kussmaul respirations, very deep, grasping type of respiration, usually associated with severe diabetic acidosis. When you have diabetic acidosis, the body's balance is thrown off, and you're not getting the oxygen you need. Orthopnea is a respiratory condition where there is dyspnea, so you have trouble breathing when the patient is in any position other than standing or sitting upright. So patients who have maybe congestive heart failure, where the heart isn't pumping as strongly as it should. So now fluids are accumulating in their ankles because the fluid's not going through the body as fast as it should, as forcefully. Fluid might pool in the lungs. They're having trouble breathing. So it's called orthopnea. We actually have terms to see how severe heart failure, congestive heart failure is, such as 1-pillow orthopnea, 2-pillow orthopnea, 3-pillow orthopnea. That means patients start to learn to prop themselves up at night with 1, 2, or 3 pillows to where they're actually just sitting up trying to sleep, because that helps them breathe. If they lay flat, they're having trouble breathing. I knew a patient who preferred to sit in their recliner chair, partly up, because they could breathe better. Pleural rub is friction rub caused by inflammation of the pleural space. So, we said that between the two membranes around the lungs, there's lubrication, but there could be inflammation, or for some reason that lubrication isn't there. So that would be a pleural rub. You could actually hear the rubbing, and it would be noted by auscultation. As we said, auscultation is listening with the stethoscope. Rouse, I know it says rails, but we say rouse. Abnormal sound heard on auscultation of the chest, or listening to the chest with the stethoscope, produced by the passage of air through the bronchi that contains secretions that or are constricted in spasm or a thickening of the walls. So anything that causes the bronchi to be constricted will cause these rows, this abnormal breathing sound, heard usually during inhalation. Rhinorrhea is a runny nose. Bronchi is a rattling in the throat caused by the passage of air through obstructed airways. Kind of sounds like snoring. That's bronchi. But you're not asleep usually, you're awake. I'm still making that sound. Sneeze, of course, is forcibly expelling air through your nose and mouth by a spasmodic contraction of the muscles of expiration due to irritation of the nasal mucosa. So it's irritated and it causes this nerve contraction to cause the muscles to do it. We cannot, pretty much, you cannot stop it when you're going to sneeze. You're going to sneeze, you're going to sneeze. Stridor is a harsh sound noted usually during inhalation. It's a high-pitched, sounds like the wind blowing due to obstruction of the air passages. You can hear it without a stethoscope, so that's stridor. Tachypnea, tachy, we always said tachy is fast, abnormal, rapid breathing. And then a wheeze, we've all heard of wheezes, like asthma, you wheeze. It's a whistling sound or a sighing sound because of the narrowing of the lumen of the respiratory passages. So in asthma, the respiratory passages become inflamed, and so air makes noise going through them because they're not as wide open as they should be. Usually during exhalation. And you can hear it without a stethoscope. If you're next to someone wheezing, you can hear it. True or false? Hypoxemia. Hypoxemia usually causes hypoxia. True. So hypoxemia means you're getting less oxygen, and hypoxia means your levels of oxygen are too low in the tissue.